this, I hope. So thanks, Ken, for that introduction. I know that I've been having some conversations with many of you, particularly around Medicaid cuts that came as a result of the Big Beautiful Bill Act. And I think it's just been really unfortunate to watch things spiral since then. Since then, we've also had the executive order on folks around housed. As Ken said, you know, the SAMHSA strategic plan was extremely disturbing to see this push towards coercive care and reinstitutionalization. You know, to say nothing of attacks on diversity, DEI, folks who identify as trans or LGBTQ plus. It's just a time where I think we're all looking for some leadership and some direction. And it's a bit challenging because I think the places that we would normally go to for that leadership may not be in place in the same ways that we're used to finding it. So, you know, I appreciate Ken you raising this and wanting to ring the alarm to bring us together. My desire for this group would be able to find some next steps or action steps that we could take moving forward with this. I don't know that we can fix all of these challenges, but I think now is the time to come together and to be thinking about the things that we can have an impact on. So that would be my desire for us, you know, tonight and perhaps moving forward, depending on what we decide to do here. So thanks for bringing us all together, Ken. I think this was a needed conversation.
Thanks, Val. So I think with that, you know, we've run these groups as kind of an open forum for people to contribute what they feel at the moment to the process. I do want to say that, you know, it's important, obviously, to be listening, but we also need folks who feel that they've got something that they want to contribute, and there's nothing that any of you can say that won't be important for other people to hear. So I want to encourage you, if you feel any inclination to reflect on your own reactions and your own thoughts about what we might be able to do together, and what we can do to support each other. I would highly encourage you to you know, voice that and let other people know what it is you're thinking. We're gonna, if you know how to put your hand up, many of us have learned how to do this. So I see Deb, you've got your hand up, and Dan. We'll go to Dan. I'll go to Deb, Dan, and then Mary.
Okay.
Mary.
You want me to go? Okay. I just wanted to let people know, and it'll be an interesting opportunity. I think many of you are somewhat aware of what we've been doing for the PPLC and over the last couple of years. And one of the important things was, of course, the Racial Justice Initiative. And tomorrow I am speaking with the Tower Reading psychiatric residents. It was originally Politics of Healthcare, which I do for Hershey every year. But as I was going through the information earlier this week, I had to redo all of it because everything I talked about since the administration is you know, is not there anymore. So we'll have an interesting conversation, and just, you know, kind of to talk about what the history is and now why. I mean, when you start to research all the history of us coming together, everyone coming together, and the uniqueness of our country and how we are, and now that those are being eroded. So just wanted to say that this will be it'll be interesting, that I'll come back to let you guys know what they say. But I am very grateful, as Ken said, for those of you who aren't just here tonight, but maybe you have opportunities to come on Thursdays. It has kept me, you know, in a better place. It's like a support group almost every week, because I know I need it. I have stopped looking at the news a lot more and things, but I really need this. And I think this is just a wonderful opportunity for us to support each other, to share experiences, to talk about how can we make things better. So that's all that I, you know, wanted to notice, is that, you know, I think we have a lot of people, obviously there's a lot of people who came on that really want to make a difference in light of what's going on. And I just think we need to continue to follow that and support each other. And hopefully, Mike, are you still writing your newsletter things every week? Because I think we need to start getting them again.
No, that was a COVID thing.
Maybe you should start up with a new one.
Yeah.
Dan,
Hi, folks. I am equally glad that everybody is here and impressed with the lineup that I'm looking at. 7 months ago, perhaps, Pennsylvania Mental Health Consumer Association did a grand invite to probably 30 different association institutions that spanned county administrator associations, drug and alcohol associations, providers, HMOs, practitioners across the board, some some advocates and lobbyists, and it was a very impressive group. The fact that they all showed up several different times, were able to actually put together a paper, a joint paper that has been used as introduction to the group, to legislators, which was going to be followed by one of the things that the single paper did was put forth specific and well, that's generalized goals and values. Those areas that needed specific documentation were done in one-pagers. That stopped meeting for the summer months, and we're now in a planning to get that group back together, refashioning it in some fashion or in some arrangement. Hopefully we could pull that discussion off early next week. Val is going to play a significant role in that. That was formed with early angst. Just the issues that were taking place then, 7-8 months ago, were alarming enough. We're further down that line now. I know also, and I'll let Val address this on her own, is that she has been looking at other arrangements with other groups to try and start to address issues in a more specific way. And every organization that I have had some association with, and Katie's a large player in this too, it has an advocacy committee that is aiming to do just that. The interesting part to me and the encouraging part to me is we have no idea what the outcome of that will be. I don't believe that there is anyone who has an idea of how they think this is going to work. I think the important part is they're all willing to do it and they understand its importance. So I do think, in fact, that there are things going on out there And we're another PPLC and the coalition or other groups with other agendas that are equally as important, and we need to pursue them.
Yep. Thanks, Dan. Marianne.
Yeah, I'll keep mine short. I guess I'm glad to be here. I'm glad to see so many faces that I know and ones that I will hopefully refresh my memory because I'm pretty sure I know them. And to have everyone's energy and voices in this. And how do we make connections? So I just in the last 2 days, Connie Dunlap and I, we share duties with Area 3 at the Assembly. And we've been asked, along with all of the areas, over the course of many months to write articles about our area. And so she was inquiring about our best practice wins over the last whatever years. And so there have been 3 in the last 4 years that Area 3 district branches have won best practice awards. And our Pennsylvania Psychiatric Society, in combination with the PPLC, so working together with really wonderful voices and thoughtful energy around how do we provide safe environments and work around a racial justice initiative that has really been fantastic and a win over the years since 2021 with a learning collaborative and a collective of residents and supportive dialogue that has been quite amazing. All in response to how can we be actionable around the George Floyd murder. There is so much to be actionable around right now. And how do you stay safe in this environment? How do you manage fear? And thinking of Franklin Delano Roosevelt and, I'm not going to get the quote right, but his quote around fear and fear itself. So, how do we stay brave and courageous and work together and partnerships? I think that's the way we're going to do this, and we just have to keep marshaling along. So I'm so happy to see Mark Matta here, and I know that the AACP has a energy. There is energy at the APA, even though many people feel that it's not enough, or in ways that they would like it not to be. There are people that are working in other avenues where we can have voices. So we need to be thinking for this group, what can we be actionable around? And I think we absolutely can. It's just hard to pick which one because there are so many, and it's hard. So, but I appreciate being here today. Thanks.
Thanks, Marianne. We have, I'll just point out, we have a fair amount of activity in the chat. Wes Sowers just dropped one about some work that he and I actually have been involved in through the Group for the Advancement of Psychiatry. We have a document out from the Systems Innovation and Transformation Committee of the GAP, which focuses on the current circumstances that actually, since we wrote the document, have only gotten worse. And I'm just take a moment while we wait for other folks to put their hands up. Dan, as usual, I don't know if you mean to have your hand up or not. I'm just going to throw a little bit of more, wood on the fire. Did anybody listen to the press conference in the White House about autism and Tylenol and vaccinations? Listen to the activities that are being proposed and the proposals that Dr. Trump advocated for. I'll bring you a small challenge that they have thrown at us, and we do hope to talk about this more. They have, as you know, they passed the bill that big tax bill, which has sent a lot of money to the billionaires, and took over the next 10 years is taking $900 billion out of the Medicaid budget. They have also in that bill indicated that they are going to put $50 billion into a rural health transformation program. This is really the height of cynicism. I mean, they are essentially going to try to convince the states that they are screwing by taking the Medicaid dollars away from. They're trying to convince the voters of those states that they're actually doing something important, particularly for the rural areas. The grants are set up so that they can be largely focused to red states. We'll see how it actually plays out. But they are putting forward $50 billion for rural transformation, which absolutely is something that we need to be focused on and engaged in. So we are now going to be dealing with the fact that at the same time that they are cutting huge amounts of people and resources away from Medicaid, they are also dangling $50 billion in front of us to try to get us to refocus and to not pay attention to what's going on with the cuts. We're already seeing the effects of this in the state. The state, desperately needs the money, so we are focusing and engaged with that. And we are not yet fully clear as to how we're going to deal with the cuts that are coming. So that's the kind of challenge we're in. How do we sort these things through? How do we deal with the lies and misinformation that are coming at us, the redirections? It's a very, very challenging and difficult environment.
I'll jump in for one more minute. This is Ken. I had heard actually at one point that that will go up really like as a grant or bids and pitting people against each other, and they're only going to accept the exception, the superlative of the Trump world, superlative stuff versus ordinary stuff. And so it has to be extraordinary in order to get the monies. And I don't know. I can't trust any of that. And the reality is, even if we got all that in any kind of way, it's not sufficient. So, the math just doesn't work. And
well, they guarantee, what they end up saying is they guarantee that each state will get at least $100 million a year. That's what they guarantee. $100 million a year, and you're having billions taken out of your Medicaid.
Right. The math is not,
It doesn't add. Meanwhile, they continue to say that the $900 billion that they're taking, so we're clear, what they say is that $900 billion is fraud and abuse, which they are basically saying that all of us who are working in a Medicaid environment are committing $900 billion of fraud and abuse over a 10-year period. $90 billion a year of fraud and abuse. That's what they're accusing us of. Deb, and then Michael.
At the MAC meeting today, and I don't know if Katie, if you were there, I know that Rosemary asked some questions or put things in. They did say that the state must apply for the rural grant. There can't be any other entities, and it has to be done through the state. However, the state and they said we appreciate any thoughts people give us. However, the problem is when the state has to do those grants and has to administer things, they're already in a deficit because of what they have to do for SNAP and the work requirements and all the other things. And already, and I don't think there's anybody on from HAP, HAP has already figured out that, prior to any of this happening, out of 27 rural hospitals, 23 were already in trouble, that were ready to close anyway. So it is kind of tricky. And the other part I wanted to mention today that was also on the MAC meeting was about SNAP. And some of the things about SNAP is that previously there were different tiers of SNAP and how there you could have coverage and other things that happen. And Brad was probably on today too. But previously there was a special exemption or special way that you could get a waiver, get some additional ways to be able to still do SNAP by geographical location, which covered a lot of the state. Well, now as of September 1st, that was taken away. So the entire state now, where some were already somewhat covered with SNAP and had some other opportunities to kind of supplement things, now the whole state is left kind of open. So SNAP is just not trying to, they're not just trying to work to try to cover people who currently have SNAP, but now they're adding people who were not under the entire state. Plus also, they already said about the unfunded mandates and how much money it's going to cost, because the Office of Income Maintenance, as not to make great news or be a Debbie Downer on it, they also have to work on the work requirements. They have to work on, there's whole new parts of it. So I think it's just a never ending cycle. And so this is a time where we may want continue like we did with the coalition to stay firm on some of these things, because there's just so many moving parts that it's very hard for the state, again, and us pushing for a state budget, because there's too much backfill and there's not enough backfill. Does that make sense?
Yep. Thanks, Deb. Mike.
Yes. First, it's great to see you all. And I can tell you honestly, you each and all look younger since I've seen you last. That's an honest remark. But on the note of the topic and the conversation, I've been in some meetings, and my biggest concern right now is when you're in a flak storm, you try not to count the pieces. And meaning, what can we do to A, stay alive, and B, get the information out to people. And I don't think our recipients, the people in Medicaid, or even those in the Affordable Care Act, have any idea what's coming. And I keep looking here in Pennsylvania, at least, to see when is the information going to come? And are there any organizations that can put that information out as a part of what they do? Or are there any people like, you remember the Russian advocate Vanali, who was put in prison and died? We need somebody like him for healthcare, somebody that can speak and be respected. But if we have the right leadership and voices, and if we get the word out to people so that they can see, everybody is in a panic right now. They're afraid to talk, afraid to make a move, and they're powerless. So that's my concern. And in fact, it comes down to two things: the Medicaid population and the Affordable Care Act right now, which I think is on a death knell through strangulation.
Now, maybe you can talk a little bit about some of the activities that are trying to coalesce around informing people about Medicaid and the SNAP things, and what are possibilities that we might do.
Sure. And Michael, I think what you're saying is true and has been a really huge concern of mine. It's particularly for the general public. I think you're right. We had a conversation with Robin Scully over at FAN, and we've had some other conversations where, we've done such a good job sort of not making people aware that they're on Medicaid. They have a health plan East, or they have a, Keystone, or they have, something that doesn't look like quote unquote Medicaid. And I think that it's going to be a very big wake up call for some folks to realize that they in fact have a Medicaid coverage. Um, in addition to that, um, there are also challenges in areas concerning how we're going to um, get folks enrolled, get them re-enrolled. Like, what does the workforce challenges look like for that? Do we have the staffing to do that? It's additional administrative burden. Where do you even begin to try to tighten up the system in order to meet those needs? Um, Additionally, there doesn't really seem to be a good plan also going to folks within organizations. We've talked with lots of folks at the university level, at the training program level, at the organizational level, and there really doesn't seem to be a lot of direction around what's going on or communication, like you're saying. I mean, there's just not basic good understanding of what is about to happen. We have timelines, but I don't think we have a good sense of like what the scope is. So on October 20th, at 11 a.m., we are going to be talking specifically about Medicaid and some of the things that we've been talking about, such as an educational campaign, or how can we be putting together a team of, maybe student workforce who could go out there and help with filling out paperwork, or just trying to come up with some creative ideas of what do we have that we can be pulling together. What are the things that we need, and who do we need to be asking for these things? Because again, I'm not totally clear what the plan is going to be from the top down. So I think we probably have to start talking from the bottom up of what is needed in the communities, and how do we supply that information to the people who might be able to make that happen. So probably a much larger conversation than that, but that's just a few of the tidbits that we've been talking about around Medicaid and SNAP.
I would think, Val, that in fact, I know some of the universities are afraid too, for many reasons, not just Medicaid. But how do we, that's why I'm looking for an entity that has said all along, our role is to represent this population, as an advocate. And does that entity exist today? I don't know of one in Western Pennsylvania. Ken, I don't know if you do, but maybe in the Philadelphia area, but somebody that would take the role to put the information out, just the facts of, what does it mean? Like right now, we're all in, it's already in effect that you have to have work to get to continue on Medicaid. 20 hours is already in force, and there's no way the managed care companies can even begin to manage this. So it's just chaos is what I'm trying to say. So how is there anybody out there that could be that agency, that voice?
And I think that's a really good question. And to add to the pile, Michael, I'm sorry to do that, but we've got big challenges around student financial aid happening. I mean, part of the fear that universities are fearing is that a federal loan is not going to guarantee what you're going to need to borrow to become a psychiatrist. It's going to not cover what you need to become a social worker or a counselor. Federal student forgiveness, that's very much questionable. They're already looking at spaces where they're limiting those opportunities. So maybe you're in a large healthcare system and they're going to say, well, if you don't comply, then we're going to take this away from folks. And there are some additional challenges at the programmatic level, where if you're graduating students who are not making enough or making more than a high school graduate, they may deem your program ineligible for federal student loans, which means when you're looking at social work programs, counseling programs, these are programs that don't graduate people who make a lot of money, not because they don't deserve a lot of money or they should make a lot of money, but because state budgets don't allow for those things to happen. So, I mean, when you're thinking about workforce, it's hitting everybody all across the continuum. And there's so many issues. And I think that's why a meeting like this is important, because there are so many areas that we could go. Who might be wanting to provide some leadership in all of those different areas. So
I will mention, I see you, Lisa. I'll come to you in just one second. I'm trying to remember the Pennsylvania patient group that has been doing stuff for years around managed care. out of Philadelphia that's an advocacy organization that we may want to connect with, and I'll have to remember what the name of the group is, but they have statewide reach.
Yeah.
Lisa.
Hi there, everyone. Hi, my name is Lisa Makovsky. I'll let you know that I do work for the Allegheny County Department of Human Services, managing a public behavioral health workforce initiative called BH Fellows. I am attending this meeting purely as a private person, a concerned person. This has nothing to do with my work. So I just wanted to put that out there for now. And as a volunteer in this effort, as a concerned citizen, I've been meeting with folks here in Pittsburgh, and we've got someone who is the executive director at the Pittsburgh Council on Higher Education. Her name is Karina Chantes, and she is interested in seeing, how she can get the universities, local colleges, and university leadership involved. So that's one person that we've got on board for sure. And I've talked to someone at the it's the Squirrel Hill Urban Coalition. And I know that's very hyper local, but she's the executive director there, is willing to help with promoting information about what's going on. And when I get things, when I get alerts, I send information to her so she can put it in their newsletter. And then we've also got the COO of the Jewish Family and Community Services, that they have programs related to aging. They have programs for behavioral health. They have programs for housing. They have resource, not coordinators, but like evaluators. And so actually, her name is Dana, and Valerie and I have a meeting with her, I think maybe in the next week or two. So, I mean, we're working on making headway here. Just Harvest is doing things here in Pittsburgh with regards to SNAP to make sure people are aware of what's happening with that. But we just need to keep, getting the word out, because that is definitely something that we've seen here talking to people, is that, folks say, hey, this is happening. And folks are like, really? They're like, you're going to lose your SNAP benefits if you're not careful, because you've got 3 weeks of like not free, but like before you lose your benefits for 3 years. Well, not for 3 years. I'm sorry. I'm totally not saying that correctly. So in a 3-year period, you have 3 weeks that you can have your SNAP benefits without showing your, if you need to be giving that work requirement piece. People are not aware of that. So there's a huge education piece to this, but we're definitely working on stuff here in Western PA. And I do know that also formally, the Allegheny County Department of Human Services is working on things too. So, but the government side, the private sector side, and then the community side with the nonprofits, these 3 sectors are all doing things a little differently, but I think if everyone's doing something, we'll cover it all. I hope. Thank you.
Thanks, Lisa. Yeah, it's good to hear that, and obviously we're dependent on many other organizations and people organizing in response to this. We're I remember the name of the organization. It's the Pennsylvania Health Access Network, and I think that might be an organization that we could make some connections with and develop some help with, or at least tie into their activities, because I'm sure they're attempting to address this. We
Yeah.
have about
And I wanted to let you know
yeah.
that we did connect with them, and the 2 things that and I'd be happy to invite Robin or her counterpart who's in the advocacy department to maybe talk to this group or a different group. But the two things that they're really invested in right now are collecting stories about Medicaid, the importance of Medicaid, why it makes a difference, or even challenges in Medicaid, which is something that we're going to talk about on the 20th, but also making sure that people know that they're on Medicaid. So exactly the issue that I had raised previously, that they're very concerned about the fact that people don't even realize that they're on Medicaid.
And that raises another thing. I have access to a form that's being promulgated that allows clinicians to collect stories from people that they are seeing as patients, and gives the patient an opportunity to allow those stories to be disclosed. So if folks are interested in that, we can obviously we'll talk about these kinds of things at future times in the meeting, in future meetings. Crystal.
So I'm really glad to hear there's a lot of great work. But it's one concern that I have listening to all this is that they're working in specific areas in their own vacuums. And there's no cohesiveness or coalition about, so what do these groups have in common that they can support with one another? And how are you, it's great that we're collecting, that we're having clinicians gather stories, but are the peers gathering the same kind of stories with the individuals that they're working with? I mean, I think we have to really start thinking about how we're building coalitions where we're helping each other, as opposed to only advocating for single issues in specific areas, especially in the state, because so much of the state doesn't have these organizations that are available in rural communities.
Yeah.
So
Yeah.
I'm concerned about not thinking about it in a broader scope and how we're coalescing.
Crystal, I think that that's a really important observation, and one of the things that this is my opinion. This is where I've come to, but I think it's supported. That the actions that we're seeing, the flack that's coming, the flooding of the zone, are all actions on the domestic side with trying to take apart the Great Society and the New Deal. This is an actual political agenda of disassembling the federal government's role as a provider of resources and supports for people. They would like to stop that because they don't want to spend the money there. And they are doing that, systematically dismantling the federal tools to create a welfare state, and then the aspects of the welfare state themselves, which throws it back then historically to the states, which historically had the welfare role until the feds moved into it and proved to be a better source of doing it because, among other things, as you all may know, the federal government can run a deficit and the state cannot. So when things go bad, you can spend money with a federal dollar that you cannot spend with a state dollar. That's an important element of this. This is an overall attack on the caring state. And as representatives of the caring state, we are going to see it in many, many different forms. And we're seeing it now. One of the ways that it's showing up is in decapitating the leadership at the federal level. So we don't have any significant capacity at the federal level right now to pull any of our actions together. That has effectively been lost. And we're going to have to figure out how different states potentially to do this. So, they've created a vaccine cooperative essentially on the West Coast because the CDC stopped functioning. We are going to need to have something along those lines around how we progress in mental health if the feds don't occupy that space. These are long-term issues. The cuts that are coming to SNAP are immediate. The cuts that are coming to Penny, to the subsidization of people who are buying their health insurance through the public plan, that is coming immediately. The Medicaid cuts come later. But these are all things that are in the pipeline, and they're all just indicative of more challenges. I have not mentioned anything about the attacks on trans people. I haven't mentioned anything about the ICE detentions. I haven't mentioned anything about the various other kinds of economic policies that are depriving people of resources and capabilities. So there's much, much more coming down the pike that's going to have significant impact on all of us. We are also getting very close to the end here of this time. What I would like to suggest, we never imagined that we would come up with a particular specific plan out of this. It took a long time for us to do some talking and to come up with the work that we did around George Floyd, but I think we came up with an extraordinary project and something that's been of real utility, and of course is definitely in the crosshairs of the kind of work, of the kind of threats that the federal government is making. Um, I'm hopeful that we come up with something equally good and equally problematic for the federal government as it currently exists, as we work together here, and that there may be many things that we do and come to. But what I want to end with, and there'll still be time for people to comment, what I'm hopeful is that if you are interested, we are going to continue to meet weekly. This is an emergency. I know everybody's tired. We had to do this before with COVID, but I have to tell you, if you have a man ranting in the White House about Tylenol and autism and scaring to death every pregnant woman in the country without thinking about it, if you have somebody during a memorial service who says, "I hate my enemies," we are not in normal times, and we're needing to start acting, unfortunately. It would be nice to be complacent. I wish we could be. We don't get that choice, I personally feel. And I'm hopeful that we can continue to have conversations in this space, and if this space doesn't work out, some other space that we figure out. But I'm hopeful that we can start to think about what we can do and who we can work with and how we can build that unity that Crystal was talking about and do the actions that Michael was talking about and Val's been describing, and that we pull together as many pieces as we can to be, all of us, part of the solution and not part of the problem. So what I'm hoping is we just feel a little bit renewed and charged up to address the actual challenge that we face. We get to we get to live in this moment. It's the only moment we got, and I guess it's up to us to figure out how we respond to it.
Well, I guess my question is how we'd like to respond to it.
Is there any representation in Pennsylvania that we could ask to both advise and lead us, such as a governor or a senator, a federal senator?
Nice try, Mike.
A good first step is to get a state budget. That would be helpful.
I do think we could probably get some legislators to talk to us at the state level. And we could potentially have a conversation with congressional folks at the federal level. I'm not sure there's much we can do truthfully at the senatorial level, but that's for discussion. Stan, you got your hand up.
Yeah, I'm thinking that maybe a first step would be for us to define our focus. Is it behavioral health? Is it healthcare? Is it democracy?
I'm going to let folks contemplate that for a second and let Marion have a conversation, join the conversation.
Yeah, no, I agree with Stan. And I think that's what Val is asking us. You know, I think we do need to have a focus. And I am looking at what Leon put in about disseminating information. And on my Instagram reels that, these days I probably am reeling too much, but I get periodically these good commercials, and they're from like foreign countries, and they have a powerful meaning. And actually the one that I saw most recently was a lovely one on kindness and being in touch with your loved ones, and how it that was the message. The other one was a very painful one that came from 2019 out of the Sandy Hook challenges. I don't know if people have seen it, but it's a back to school commercial, and it is very, very powerful. So I guess I'm wondering, do we have anybody that can partner and that we can start to buy up some PSA time to get that information out to a public?
That's a very interesting thought. I know some people who are actually putting together billboards, and there's a whole movement right now that they call the overpass sign drop. Uh, so the notion of getting a message out to people, I think, is a very important one, and one we should hold on to and think about. I also want to be clear, nobody is thinking, and at least I haven't heard anybody here, who has the solution to the problem already worked out. It would be great if we could just go in and do something immediately. I think this is going to take a little bit of thought, and it's going to be an ongoing thing, because this emergency is not a simple one. It's got lots of parts, and it's continuing. It's not going to get better. Until we stop it, it's going to continue to get worse. So we just need to be anticipating that we may need to respond to something that's even more heinous than what we've already experienced any day soon. Dan, and then Lisa, and then we're going to be very close to the end here. Oh, then Mary. We'll get everybody in. Mary, no, don't pull your hand. You're still on.
There are a lot of things that are going on simultaneously. I think we just need to do all of them. There are, I don't think that we have the luxury of worrying about the perfect in place of what is practical. All of these groups will serve a purpose. All of these groups will start the dialogues that need to be taken. One of the things that we have talked about, and that is a great danger with this, is there is always a scattergun approach that is taken by this administration, so that there is chaos every place. We can't address chaos everywhere. We're not capable of it. There is no real solution yet. We just have to, I don't want to sound like a Nike commercial, but we just have to do it. We just have to get involved, and we just have to get going. And as those things mature, then we can make it pretty. But right now, it's trench warfare, folk.
All right. Yeah, I like the idea of making it pretty later. Lisa.
Dan said exactly what I was going to say, that we have to be very careful how we manage our expectations of ourselves and our work that we're going to try to do here as a group, that there's a lot to do. And, sometimes it's one of these things where you have to have multiple balls up in the air, and they're going ahead at different rates, and that's okay. And whatever we do, we just have to do it. We just have to start and contact and just start talking to people, and it will start to shape itself organically as we progress in our work, and that's totally okay.
Yeah, thank you. I learned how to juggle in college. It's maybe one of the few things I actually did learn. And the way it starts is you start by throwing one ball in the air. And then you throw another one and you can't catch both of them. You just can't. And then you learn. Mary.
So I'm newer to the group, not newer to all the some of the people in the group, but one of the lenses I have, and Crystal really kicked this for me, is that I was a community organizer for a while. And so one of the things that happens, right, is that I feel like we lose focus because there's so much coming at us. And I think we used to talk in community organizing about where can we win, but also where can we build larger coalitions that you brought up, Crystal, about coming together on one strategy and creating more force. Because the more people, I mean, just there's greater power. So, one of the things and coming a couple times is everybody keeps talking about people don't know. And so is that the focus, right? Is it what you said, like I think Marianne said, buying up PSA space, right? Like making things visual, meaningful, that really hit, because it's not happening from the state level. And so, like, is there a place where people can agree, we're going to focus in this area, we're going to do this, and we're going to figure out who to do it with, and that will be one piece of what we do, but that creates some kind of focus, because there are multiple balls rolling, but some of these aren't any different. They're not going to change, is I guess what comes up for me. And
Yeah,
just
thank you. I think what we're hoping is that as we talk a little bit, we find that there's some convergence on particular actions that seem to kill more birds with less stones, as a place to start, and then we see where we go, what the practicalities lead to. But I think, it's process and action and the relationship between the two of those things that we want to do as well as we can. And I think it will happen organically when we have the opportunity to meet. We are, I'm usually really a stickler about time, so I'm going to say that we are past 7 o'clock. I'm going to stop us with this small proviso. I'm hopeful some of you will return next week and we can begin to continue to think about where this action and activity can go. But I also want to make sure that we also keep in mind that another function of the group, and this was really important during the COVID time, is to just help us personally keep our bodies and souls together in the face of the challenges that we are obviously aware of and seeing every day, so that we don't blow up inside or find ourselves feeling powerless and unable to be part of anything. So this is also about making sure we have the opportunity to debrief a little bit and connect with each other and figure out how to do the work. It will turn out that the work gets easier the more connected and more supported each of us feels. So I'm hopeful to create that environment. We will meet again next week. We're keeping this focus. We are having a meeting of the PPLC in November, on November 3rd, where we're talking about some of these activities. It'll be in Harrisburg. You can join online or in person. So there'll be more opportunities to have some discussions about this and other issues. I think with that, Val, unless there's something that you think we need to add, I think we'll send everybody off to dinner.
Yeah, I just wanted to make sure that the plan is you'd like to continue to talk about this next week, maybe identify some next steps if folks would be open to that. I can make sure that Lucy sends out the calendar invite to everybody who made this call. And if you have others that you want to be included in this conversation who are not normally invited to this meeting, please let me know. We'll be happy to get you on the invite list.
Yep. More people we can get here, the better. All right. Thank you all. Have a great evening.